Let's talk about the gait cycle. We're going to focus on the right gait cycle. For this, we're going to follow the leg during a full stride. We should begin by defining steps and strides. A step starts with the initial contact of one foot and ends with the initial contact of the other foot. How does this look? Well, it starts with the initial contact of one foot and ends with the next initial contact of that same foot. So it's made out of two steps. Let's start looking at the two phases of the gait cycle. First, there's the stance phase, which is making up 60% of the full gait cycle. The right foot is always in contact with the surface, giving it the term stance. During swing phase, which is 40% of the gait cycle, the right leg is swinging. Let's focus in on the stance phase first. The right leg has to complete different tasks. First, with heel strike, the leg has to accept the weight of the body. This loading response here signifies the first 10% of the cycle. The loading response is complete after the contralateral foot is off the ground. We are now in single leg support here. From here, we can dive deeper into the load response up until the point of heel off. This period is called mid-stance. So far, we've observed 30% of that full gait cycle. The heel of the right foot starts to lift while the contralateral leg has initial contact with the ground. This portion is called terminal stance. By this point, we have reached 50% of the gait cycle. We're almost through the stance phase. While the contralateral leg advances to make contact with the ground, the right leg lifts off the ground. Now we've reached the pre-swing and have observed 60% of the gait cycle. Stance phase has completed and we start the swing phase of that right leg. We subdivide the swing phase into initial swing from toe off until the feet are next to each other. There. At this point, we observed 73% of the gait cycle thus far. After initial swing, a short period called mid-swing exists and it lasts until the tibia is vertical. 87% of the gait cycle has now elapsed. We must observe the body from various angles while comparing right and left. Ask your patient to walk at his or her normal pace. This patient is walking at about 2 miles per hour. Average is 2.5 to 4 miles per hour. We should be looking to see if there's a shortened stance phase. This is typically the most obvious gait deviation from a normal gait pattern. A patient who is limping from pain might have decreased stance time. When observing the torso, check whether the trunk is anterior or posterior to the hips, or if lateral flexion is present. In some patients, arm swing might also be reduced. Next, look at the pelvis for excessive posterior rotation. The patient may need to expose landmarks for you to assess this. Check the amount of extension and whether that is reduced. Repeat this process at the knee. Also, assess knee flexion throughout the cycle. Furthermore, check for normal ankle plantar flexion, which might be reduced. The last item you should observe is any amount of internal or external rotation of the leg. This might show through excessive toe out or toe in.